joining us now on the program is going to be Dr. Richard Besser, who is the president and CEO of the Robert Wood Johnson Foundation, but also a former CDC Acting Director. Dr. Besser, good to see you.
Great to see you. Thanks for having me on.
Of course. Now, when we hear all of this news coming out of the CDC, what are some of the concerns that come first to your mind, especially when it comes to the leadership for the agency?
Yeah, it was very disturbing to me when the head of the CDC was removed earlier this week, and we saw the departure of other leaders. I worked at the CDC for 13 years, and one of the things about public health is that it's often invisible. When it's working effectively, people don't see it. Public health is what makes sure that when you go to a restaurant, the food is safe to eat. When your kids go swimming, the water is clean. When there's a new infectious disease on the horizon, that we're ready and we're prepared. What we're seeing now with the loss of so many people from the CDC is that the ability to do those basic things is at risk. I'm a pediatrician, and I practiced pediatrics for more than 30 years. And I turned to the CDC to get the information to provide to my patients so that they could make the best choices for health for their children. I am very concerned that we're no longer going to be able to get that kind of science-based evidence without the politics that we count on when we practice medicine.
When we talk about getting that science-backed information without the politics, and we look at what's happening, especially throughout the last several months with different agencies, not just the CDC, is this something that you have seen before, maybe in the past, so we know kind of how it's going to go going forward?
This is something totally new. This is not something we've ever seen before. Secretary Kennedy, since he's come on board, has slashed the funding to the National Institutes of Health. That may seem like it's not connected to people's lives, but the NIH is where new treatments are developed. It's where we learn about new diseases, so that people, when they see their doctor, have the best treatments available, the best treatments in the world. That won't be the case if we're not investing in science. We've seen thousands of people be cut from government. Public servants who have dedicated their lives to keeping people healthy and safe here and around the world. Without those people in place, we are at risk for diseases that we shouldn't be at risk for.
And Dr. Besser, I feel that you can offer a unique perspective as someone who has been in that position before as a former CDC acting director. When you think about some of the qualities that kind of leadership should possess to make sure that everything is run effectively, what would that be?
Yeah, so I worked at CDC for 13 years, and for 4 of those years, I was in charge of emergency preparedness and response. And so the reason I was put in the role of acting director during a time of political transition was to ensure that if there was a public health emergency during that period of instability, someone was in the seat who knew the agency, knew how to respond to a crisis. It was a good thing that they did, because during that period, in 2009, that was when we had the H1N1 swine flu pandemic. And so I was able to move forward in a constructive, effective way to get that response going. Right now, we have in place a political appointee who doesn't know the agency, who doesn't know how to practice public health. And so I worry that we are at risk if there's a public health threat that comes. But it's the everyday work of the agency, making sure that people who have an addiction problem are getting the treatment they need, making sure that children are not starting smoking, making sure that if there's a problem with the water supply, that there are people at the CDC who can come and help a community do that work. People in rural America are at increased risk, given the role that public health plays in ensuring that there's access to community clinics and that other public health services are available. And that gives me great concern.
Speaking of handling some of these crises when it comes to public health, like how we saw with a coronavirus, for example, or several other diseases that we try to get control of before they cause too much devastation, although it still happens some of the time. Can you walk us through how that workflow goes when you first identify something that could be critical to the public? and just where the CDC kind of comes in and how they work with all of those local hospitals to make sure that people can stay safe.
Yeah, so most of the money that comes to CDC, our tax dollars, goes from CDC out to state health departments, local health departments, county health departments to ensure that they have people on the ground who are going to pick up something first. CDC is located in Atlanta, and there could be health issues that start anywhere around the world. And what those local health officers will often do is turn to CDC for advice. If it's a new infectious agent, they'll send it to the CDC so the laboratories can look at it, analyze it, see whether it's something we've seen before, and how best to respond. I started my career at the CDC as a disease detective. And disease detectives at CDC are called out by local health departments to help them investigate new health problems. I worry about the ability of CDC to meet the requests from those departments. And what you need to have at the CDC are really the top infectious disease experts, the top chronic disease experts, so they're able to look at the issues that are springing up around the country and give people in their communities the best advice so that they can make the best decisions about their own health. That's truly what we want to see from our government public health system. It's what our tax dollars are designed to provide.
Well, Dr. Besser, we certainly appreciate your time here at Live Now from Fox as we follow this developing story. Is there anything else that you would like to add before I let you go regarding the future of the CDC and really your hopes for when we come out of all of this?
Yeah, what I would recommend to people is that rather than thinking about the recommendations coming out of the CDC, which I have great concerns about whether they will be evidence-based, talk to a health provider that you trust, your doctor, your child's doctor, your nurse, your pharmacist. Get advice from them so you can make the best decisions about your family's health. I used to say, look at what the CDC is recommending. Unfortunately, because of the politics that is invading that agency, I don't think that that's the best place to look right now. The people who work there are courageous public servants. They're doing the best that they can. But for now, I would turn to your local health provider for the information you need.
Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation, also former CDC Acting Director. Again, we appreciate your time here at Live Now from Fox, and we hope to check in soon.